Hello, everybody. Welcome back to the Facts and Fallacies podcast. My name is Cameron English. Excited to be with you as always. You may notice Dr. Liza Dunn is not with us today. She's out traveling the world doing her fancy doctorate and stuff. But that's okay because we have an awesome sit-in, an awesome guest. Of course, I'm talking about Dr. Nikki Johnson, who is with FAIR, the Foundation Against Intolerance and Racism. The way I've been introducing that to people, by the way, is to say when you guys say that, you actually mean it. Unlike unlike a lot of people that talk with some of those terms. But in any case, welcome to the show. First of all, thank you so much. And then why don't you take just a little bit and introduce people to you because they may not be familiar with you.
Oh wow. Okay, I'll try. I'll make it as quick as possible. But thanks for having me, and welcome to anybody who's listening. I hope that you get something out of this that you can use to help yourself be healthy and advocate for yourself, advocate for patients. So, I am Nikki Johnson. My full name is Nicole Johnson, but I go by Nikki Johnson. Affectionately, Dr. Nikki. Adopted that name from both my patients and on social media. I have been actively working in healthcare reform for quite a few years, having co-authored a couple of white papers through a large grassroots organization called Free to Care, and with the intent of lowering costs of healthcare and making healthcare quality more affordable, eliminating the middlemen. And so I've been active really on social media and sort of in the political landscape about healthcare for quite a few years now. And so really, I left my clinical practice in 2023 now. I keep getting the years mixed up, but I left voluntarily as an early retirement. Part of the reason was just burnout in general, but the other part of it was I was very frustrated seeing the politicization of healthcare and really feeling like I was a solo voice, screaming out into the void without being able to directly, change things for my patients. So I wanted to find a way to use my voice in a different way. And so I've been working as an independent consultant since then, doing advocacy, writing, speaking, working with Fair for All, multiple, other different organizations. So.
Yeah, and your work is excellent. And we're going to talk about an article that you wrote back in February that ties into everything you just said. And I would encourage everyone to read the Substack for one thing that we're going to talk about because there's good content on there. But then these series of webinars that you've been hosting have been awesome. And I don't just say that because I've been at one of them. Though they're really good. You guys are taking on topics that are critically important that everybody, I think, wants to know about, but a lot of people are afraid to explore in any depth. And you just sit there and you're like, okay, we're going to talk about this because we need to straighten this out, So check out the webinars. And then let me introduce this article. So this is on FAIR Substack. It's called Call to Return to Core Medical Principles. Really good stuff. I was going to introduce this, but I think I'll just let you do it since you wrote it, right? What I got out of this is that you're talking about politics, not just infiltrating, but it seems to have completely taken over medicine in some cases. And if I understand your argument right, you're saying this is harming patients. This is leaving doctors less well prepared to do their jobs, and this is just bad overall. That's what I got out of it. Maybe you can flesh that out for me.
Yeah, I mean, this topic I believe is really broad. On this specific article, I was talking about changes to the Hippocratic Oath, and let me just kind of rewind a second though too. Where I sit in medicine is I want us to return to the roots, and the root is this compassionate, beneficent, and field, a profession which has a high level of integrity, high level of responsibility towards the standard bearer of truth and reality for people. And what I think has been happening is we've been going away from that to a more ideological practice in healthcare. And the influences have come from multiple different places. There's been influence from the corporate side of things, because doctors gave up a lot of their autonomy and a lot of the control over the business side of the practice of medicine to government, to insurance companies, for decades now. So we're seeing the effects there. And so they are driving a lot of our conversations. They're driving a lot of policy as well. And then on the other side of it, you also have sort of the political activist side of things, that controls conversations. They not only control policy, but they also control how medical education is and training is conducted. And so I'm one of the people who I believe we need to go back to that original intent of it, to really treat patients and regard health as the ultimate outcome, and not only the absence of disease, but sort of preventing disease itself from happening. That really should be our focus. And really basing that on the medical side, the scientific side of it, basing it on evidence. And then also, to an extent, what the patient wants, what they view as their quality of life, and not this sort of authoritarian, approach. And so what we're seeing, I think, is a push-pull of two sides of a political activism. On the one hand, you see people who are really focusing on these quote unquote social determinants of health, and really putting emphasis on that in determining health outcomes. And then you have the other side that is that wants to, completely somehow, lately we're seeing a lot of people who want to dismantle things that actually have been proven to be beneficial, but say that they want to go back to the scientific evidence. But there's very few people like me who are in the middle who want to say, hey, wait a minute, let's actually look at the evidence, what works, what keeps people healthy, what prevents disease, and what can we do as, partnering with each other as patients and doctors, and nurses, of course, included, and other professionals and health professionals. How can we work together to make you the healthiest person ever, and or restore your health when you are ill, and cut out all the other noise that's on either side of it. And it's really just I think it's a lot more complex than that. But this particular article, I was talking about the Hippocratic Oath, because it had just been reported. At least I actually saw a post from someone who I think it was Aaron Siberium. Let me kind of scroll through. Yeah, he's a journalist who writes about writes about medicine. And he's been focused a lot on the politicization of medicine. I've actually spoken with him about the American Academy of Pediatrics, and some of their policies where they shifted during the Trump initial years, based on sort of a political position rather than a medical or a scientific position. And he exposed, I believe that was, let me look back through it really quickly. I think it was Brown? Yes, at Brown University School of Medicine, the faculty promotion criteria was changing to make a major criteria for promotion have everything to do with diversity, equity, and inclusion, and a minor criteria, actual clinical performance. So anyone who's actually either a patient or someone who's practicing medicine would be alarmed by that, because you would think that the clinical part of the treating the patient care should be the thing that's valued the most, and not these justice, or I don't even like to even use the word social justice, because I think justice really is about the law and legal system. That social justice has been named. It's basically saying that activists and politics have entered medicine. These are the things that are more important. And that's to me what Brown University is saying by promotion criteria. So you're de-emphasizing the real quality, aspect of medicine is scientific rigor, understanding human physiology, understanding, what makes a person healthy and what makes a person unhealthy, and demonstrating that is now devalued for diversity, equity, and inclusion. And that had got me to looking at the Hippocratic Oath statements of medical schools and curriculum requirements for accreditation for medical school. And I did not report the accreditation stuff in this piece, but I just did a Chat GPT search and looked at what statements had changed in the original Hippocratic Oath. And there were more than 30 medical schools in the U.S. and Canada who had changed or added statements that were specifically focusing on diversity, equity, inclusion, or implicit bias and that kind of thing in their Hippocratic Oath. And really just, to me, it's replacing the scientific rigor, the original principles of beneficence and compassion in the original Hippocratic Oath. And that, to me, set off alarm bells.
Well, it should. It should. I mean, from a patient perspective, it scares me to know that at some point in my life, I might see someone, or my children might see someone who's not necessarily qualified to take care of them. That's scary. And what maybe in a broader sense, what I find so strange about this push for DEI in medicine, or whatever you want to call it, is that it's leaving people who have the least access to care worse off. So so like a low income family, they don't have the same access to care that someone who's wealthy does, or someone that lives in a rural part of the country. The same thing applies, right? So the chances are they're going to end up seeing someone who can't treat them appropriately. They're more likely to have a bad experience, and then as a result of that, their perspective on the healthcare system is going to be, I don't trust any of you people, because you don't, like when I was in your office, you blew me off, or you gave me the wrong drug, or whatever. So the next time you're in a pandemic and you want people to take a vaccine, or you want people as a population to follow your advice, it seems to me they're going to be less likely to do that. What do you think of that?
Yeah. So my concern here is, look, no, I am not against diversity. I am not against equitable treatment or fairness. And I am not against including people. But DEI is not about any of those things to me. DEI is more about dividing people into groups and demographic groups, and deciding that certain groups need to be favored over others. There's an oppressed group, there's an oppressor group. The oppressed group needs to be favored. They need to have their needs catered to them. And in many cases, we're even seeing health or normal responses to life, depression in a circumstance that would make you depressed, like grief or a job loss or something like that. We're seeing that pathologized, and we're seeing it pathologized to certain groups of people. So you're a group of Black men who are depressed because they have these circumstances are now in a mental health crisis. And it's I'm probably not articulating this the best way, but to me the concern is that what you're doing is singling out a group of people and making them more into victims than giving them the tools that they need to actually, one, be supported, and kind of go back to being healthy. And you're emphasizing those things, but you're not really then looking at the diabetes itself that the patient actually has. They came to you because they have rapid weight loss and they're suddenly urinating, and then you're focusing on the fact that they're that they're Black, or that they live in a poor neighborhood, and this is the reason that they have diabetes. and when you really should be talking to them about lifestyle changes and things that it actually can, either help them lose weight or help them have some glycemic control, just the same as you would a person who lives in an influential, who comes from an influential background, or who happens to be a different skin color, or is a part of the oppressor group that you've labeled them to be in. And that's a big part. That's a part of this, is that you're not saying we want to be diverse, we want to be inclusive. You could actually just do that. Really, you could just do that as a medical school. You could just say, look, hey, we need a little bit more diverse population here because we have a diverse demographic in this area that we need to take care of, and maybe we need to represent them. Why don't we just go ahead and hire and then work on retaining these type of people? No, you're actually creating policies that divide people and single people out, and actually you're harming the people that you're supposed to be protecting. And specifically in this area, I think that, a lot of this for me was, initially kind of speculation and worry. Not only being a Black person and minority coming from a poor, lower class background, I never wanted to be singled out as a Black woman coming from a lower class background. I wanted to be singled out as an intelligent person who is qualified to be here in this medical school, and I deserve to learn just as much as the white guy who came from an affluent neighborhood whose family can afford to pay for his way through medical school. I want to learn just as much as that guy, have the same experience as that guy. That's what I want. And I don't want to be singled out or treated differently. I don't want to be added to the numbers in the pool just to give, a spot of color to your medical school. I don't want to do that. That's not fair to me. And it's not it's not fair to me to be singled out and to be viewed as being there because I'm a quote unquote DEI hire. So it's bad for both. The second thing that's bad is when you start to emphasize these political issues, and particularly in this area of race, you then start to, again, de-emphasize the scientific rigor, so much to the point that you can actually harm patients. And a recent article that was actually published by Dr. Sally Satel, she's a psychiatrist who is actually one of the Fair in Medicine Fellows. She wrote an article in City Journal that was going over the early reports of the United States Medical Licensing Exam Step 1. So for the audience that doesn't really know this, so that exam is the first part of the licensing exam that every single medical student who goes to the U.S. and Canadian school needs to take in order to actually practice medicine, get a license in whatever state that they're practicing in. Everybody has to pass this. It's a U.S. nationwide exam. It's actually it's the most rigorous portion of the rigorous step of the exams because it goes through and tests all of your kind of basic science, core medical knowledge. And so it was scored with a numerical score in previous years. In 2019, activist groups from the Federation of State Medical Boards, which oversee all state medical boards, and the accreditation board decided that they wanted to make this exam into a pass-fail exam. So with the idea that students could then get a chance to go to residencies and compete in programs that they wouldn't otherwise get to compete in based on numerical test scores. Well, it is true that competitive residency programs, competitive fellowship programs, I know for sure that my fellowship program, which was pediatric critical care, looked heavily at USMLE scores, particularly steps 1 and 2. because those scores actually correlated with your success in the program and being able to actually pass your board exam. The initial board exam is the test that says, hey, you have mastered all of this material. You can go out and, and put this plaque in your office and tell everyone that you've mastered this material and you're safe to take care of patients. That exam actually does correlate with not only patient safety outcomes, that first board exam, but also that USMLE Step 1 exam scores actually correlate with in-hospital patient mortality. So when you get a medical student who's graduated and has gone off to their internship and residency program where they're training to take care of you, if those students haven't done well on that first step of the licensing exam, your chances of dying in the hospital are higher when they don't do well. So if they just have a pass versus a fail rate, just the pass doesn't really tell you the number and how well they did. So you don't really know what you're accepting into your program if you're a residency, program director. And so, which means then you as the patient don't really know the qualifications of the doctor who's taking care of you. Now, I'm not saying that every single one that passes, even on the lowest kind of minimal average in, standard of within, one standard deviation is going to be that person who doesn't treat you so well. Some people aren't great test takers. I know I wasn't like the greatest test taker, but, I did reasonably well on my USMLE's, Step 1. And I did complete my residency, complete my fellowship training, that kind of thing. And I focused, on really getting a great score on the exam. I didn't focus on just passing the exam. So there's a difference. When you have someone who's actually focusing on doing well on the exam versus just passing the exam, that also does something for the psyche for that person who's taking care of you. So to kind of summarize everything, this emphasis on social issues and political issues has created this exam situation where we have now a place where residency programs can't even look at the students who've graduated and decide whether or not these people meet our standard of qualification for doing well in this program and then also taking care of patients. Well, Dr. Patel's essay summarizes the initial report. And the initial report, looking at these test scores over the last 10 years in comparison with the new pass-fail rate, show that the early reports from the 2024 exam show that we've had a decline, a significant decline compared to in the last 10 years. And all across the board, first-time test takers from the United States and Canadian medical schools, first-time test takers not from the U.S. and Canadian medical schools who are taking the test to try and to work in the U.S., and non-U.S. citizens who are taking the test. And those citizens may or may not have gone to U.S. Or Canadian medical schools. So across the board, we've seen a drop, and I believe that the largest drop was in the non-U.S. citizens group, and that was about 8% drop in their first-time test-taking score. And we do know that the more times you end up having to take the test, the less likelihood is you're going to pass. But we're also seeing now with this pass-fail rate, the students who have had to take it multiple times are failing at even higher rates. So we basically did the experiment that an emphasis on what I call fake diversity emphasis, because it's not really what you're doing. You're really basically saying we're going to lower the standards across the board for people getting into school and getting into residency programs. That's what you did. You didn't really say, I want more Black kids, I want more Native American kids, I want more Hispanic kids going into medical school and then going into residency program. But yeah, I want to I want to help them, be qualified before we pull them in. And then once they're here, make sure they're qualified to practice medicine. You didn't do that. You lowered the standard and you said these people can go off and go and train. And what the fallout from there is going to be lesser trained and poorly cared for patients. It's not hyperbole to say that. We actually have the data now.
But I want to feel morally superior to everyone else. And if I just check a box, then I get to do that. What you're suggesting is that I actually put in work and reach the outcome that I want. I don't want to do that. I just want everyone to think that my medical school is very diverse and accepting.
Yeah.
What I was going to ask you, so Thomas Sowell, the economist, wrote a great book called Visions of the Anointed, and this is what he talks about. Every chapter is on a different subject, but he says, you get these tinkerers, these busybodies that want to run society. So they set up a real-time experiment. It fails because they're not capable of running society. But then when it fails, inevitably they say, well, we just didn't do enough of our whatever, right? The taxes weren't high enough. The rules weren't strict enough. The war wasn't long enough, whatever it is, blah, blah, blah. And then they just double down, right?
Yeah.
What it sounds like you're saying to me is what's happening here is like, they're not going to go, well, we ran the experiment. It's time to try something else. They're just going to hit this even harder. Do you think that's what's happening right now?
That's a great question. I haven't looked at sort of the medical and academic response to this. I do know that the Trump administration, as you probably know too, has issued executive orders that they're not going to fund publicly funded schools that are promoting these social justice types of programs in science or anywhere in academia. So I have not seen a ton of response from organizations that both accredit the medical schools or create the curriculum, but I've also not seen any efforts to actually kind of scale back on some of this stuff. I don't. What is interesting though is that there's a podcast. I'm just gonna get the name of it. It's called by the New England Journal of Medicine. It's called Not Otherwise Specified, and I think it's now it's a 2024 series where the doctor who hosts it goes through some of these topics and speaks with faculty, speaks with current medical students about some of these issues and kind of what they perceive the effects to be, and in some cases what the effects are actually that they're actually seeing. And there's one episode where she actually speaks with faculty. And faculty who, a particular faculty member who spoke out, she's a program director. So the programs who, a residency for pediatrics or residency for internal medicine, they have a director, and that director is, the faculty at the medical school and is also usually on staff at the hospital. And they oversee who actually gets into the program, right? And so they have this private list where they can talk to each other and ask each other questions, bounce ideas off of each other. And on this list, a faculty member spoke out and basically said that the students are running the show here and we need to stop letting them run the show, in so many words. And particularly this was on an issue of wellness and mental health and well-being. So the residents now have to have limited work hours that they have during the week. And they also have these things now they call these wellness or health and wellness hours or days or things like that. And that has actually been growing in emphasis. And so sometimes there were some reports that some of the residents were asking for, a mental health day so that they don't have to show up for their clinical responsibilities because they need this mental health day. And it just sounds like more and more of this is happening. And when you actually look at a lot of the literature that's promoting some of this social justice, and these social and political activism, when you look at the scientific literature, it's actually being published by a lot of medical students. In particular, I don't know if you saw, Cam, this recent article about transgender, surgery having a negative effect on the mental health of their patient, of the patients who actually, after they've gone through the surgical, transformations, that they're more suicidal in some cases. I don't know if you saw that. Well, that was actually written by a group of medical students who are also advocates of some of these of gender affirming care. And at the end of the article, when they talked about the results, obviously they were disappointing. But for them, the answer was then, well, no, we're not doing. That means these patients aren't getting enough mental health. We're not doing it right. We're not doing the mental health part right, right, after they've had their surgery. Not there's no questioning whether or not we should be doing this in the first place at all. It's we are still going to do this, but we just need to do it better. It kind of goes to that. And so what we're seeing here, I think is this I think this is a broad problem within medical academia, that we're listening to medical students dictate and allowing them to dictate a lot of policy. And that's one of the regrets and the comments from this faculty member who was speaking out on this listserv, who then got kind of ostracized and bullied by some of the other faculty. But they really had a great, candid discussion about it on this podcast. So I highly recommend it if people hadn't, heard it. It's the new, at least it was on Apple Podcasts when I listened last, and I'm not a big Apple Podcast person. I usually listen to Spotify, but it's the New England Journal of Medicine, and it's called Not Otherwise Specified, and I think it's about eight episodes during the series. But it really was a good examination of a lot of these issues, and I think it was pretty honest, and it needs to happen. But I don't see that it's going to happen. And with the Trump administration being really, really kind of, swinging the pendulum, back hard the opposite direction, I'm only seeing a lot more resistance and people who are going to double down. So I'm not optimistic that this is going to change anytime soon.
Neither am I, unfortunately. And I'm trying not to be too cynical these days for my kids' sake, but I just can't help it sometimes. We talked on our weekly space, which you attended and participated in, which I was so happy to see. We talked about some of these cuts to science funding, and, the reaction from academia and from the public health establishment to, in a lot of cases, what seems very reasonable to me is just this outright panic. They're shocked and dismayed, and if you take our funding, then we're not going to be able to put chemicals on cells in a petri dish, and you're going to withhold the cure for cancer if you take our funding, and it's let's all run around and light our hair on fire. It's basically the response. But there's just a complete lack of self-awareness among these people. I mean, you talk about this gender hysteria, which is just, as a father now, I mean, this is delusional. The fact that so many smart people are going along with this blows my mind. I mean, the evidence base is garbage. You are permanently scarring these kids, and then you turn around and go, well, we just need to do more. I'm like, but anyways, my point is, it's like, you keep going when there's a negative reaction to it. You just say, well, how dare you? I mean, don't you know I'm smarter than you, and I'm supposed to make decisions for you. You're just supposed to give me your money, and then I spend it on whatever study I think is useful. You know what I mean? Yeah. So in other words, like, my only response at this point is to say, well, this just has to keep going. Like, you need to lose more funding. You need to lose more of the respect that you have and more of the authority that you have to make decisions over other people's health, because you don't get it. You clearly don't get it.
Yeah.
What do you think?
What you're doing is, yes, you're ruining people's health. You're not helping anyone right now. You're actually harming people. Here's my answer to the people who are walking around with their hair on fire because of any even threats to cuts or flagging terms, because that's really what the latest piece is about. They're flagging terms and proposed science and proposed grants from the National Institutes of Cancer, so they're now worried that they're going to start take away funding for all of these things. Maybe there's some people who are panicking also because their funding was frozen for something that they're already done, which is understandable. But my answer to them is, look, if your hair wasn't on fire when we were screaming to you about the authoritarian nature of how you created COVID policy, we told you were going too far. We told you that you were using the science of your choice to actually make policy decisions. You were being an activist instead of a physician or a scientist, or you were silent while we were upset and calling these things out and asking reasonable questions, asking for more transparency of data. If you were silent during that time, and now all of a sudden your hair is on fire because someone's going the opposite direction and doesn't believe in the work that you're doing, and you now suddenly believe that's authoritarianism, then you just don't get, honestly, I don't want to hear it because I don't trust you. I think that you are politically motivated. You're not actually motivated to actually do quality science. And sure, there's probably some of you who are out there doing quality science and quality research that's necessary to benefit human health and longevity. But if you were silent while we suffered, while people who lost their jobs because they didn't get a vaccine that was harming people or wasn't well studied, if you were silent because people were, businesses were closing, or people were dying at home of heart attacks because they couldn't go into the hospital because it wasn't an essential medical care, or they didn't get their cancer screening because it wasn't an essential service and they're dying of some cancer that could have been prevented, you don't have standing to me. You don't. You went along with something that wasn't necessarily scientific, that wasn't rigorously studied, that was purely political ideology, and you didn't pay attention to the people who are trying to tell you that this is worrisome when you're censoring information. And now it's happening to you. I don't really have the empathy. I'm sorry, I don't. I tried to be at first. I tried to be kind of in the middle of the road. I think the people who were always in the middle, asking the question and saying, hey, this is something that's really concerning. We should be talking about healthy debate. We should be completely open to that. We should divorce medicine and science from politics and really promote good quality evidence that's transparent. And we should require pharmaceutical companies to give us all of the data before we say that we're going to endorse something. These are the people sitting in the middle who are questioning both Bobby Kennedy and who also question, the two CDC directors under Joe Biden. We question them and Tony Fauci. If you're one of those people, hey, you and I can talk because I think we can have a reasonable discussion. But if your hair's on fire now just because it's happening to you, I don't trust you either.
Yeah. Yeah, it would be comical if it weren't so sad, and you know this probably better than me. The amount of crappy science that comes out weekly, that's funded by NIH, that's funded by NSF, that's funded by one of the agencies like FDA, it's like a limitless stream of garbage. And it's all paid for by us. I mean, studies about,
Yep.
the antidepressive effects of vitamin B12. I'm like, give me a break, right? Like, that's bullshit. So do I. You know what I mean? Like the people doing this, like the results are, well, we saw a trend towards an effect. It's like, you didn't see anything. That's what you saw. This is a waste of everybody's money. And
Yeah.
the examples go on and on and on, right? This chemical that we've been using for 50 years, well, it actually is, causing inflammation in your brain. It's like, no, it's not. It's just a waste of everyone's time and everyone's money. But the wheels have to keep turning, right? The agencies need to make their grants. The researchers need to get their grants. The universities have to put out their press releases. USA Today needs its miracle vegetable headline so it can get ad revenue. It's like, it's all just a machine, and nobody really cares about the results. That's what's most frustrating to me, because and you saw this too, I'm sure, in the lead up to this for the last year or so. Everybody was like, this amyloid hypothesis is based on shoddy data. We've spent at this point billions of dollars on it in terms of the investment from pharma companies and all of the clinical trials. We need to fix this. We have a replication crisis. First it started in psychology and now it's everywhere. These are real problems. We need better science. And then you get one guy in there, and because you don't like something about him, right? You don't like his hair or his, the way he carries himself, whatever. You're like, whoa, 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 whoa. You can't actually cut the funding. Like, you can't actually tell us to stop and tell you what we're doing. That would be, do you want us to cure cancer? Because we can't do it without, it's like, it's all such
Yeah.
a scam to me.
Yeah.
And I just
Yeah.
go, this, fine, like, take a hammer to it. I'm over this,
Yeah.
and we'll figure it out on the other side. That's all I can.
Yeah, and you know what? I'm not, I'm okay with a big, big blunt approach, and let's do a reset here. And what are we doing? Like, really examine, what are we doing? And I think that there's some really legitimate questions from people, about healthcare benefits of things that we're promoting. I don't, agree with completely dismantling everything that has been helpful to advancing, increasing longevity and lowering mortality rates and kind of increasing life expectancy over the years. I'm okay with some preservatives. I'm okay with some vaccines. I just think we need to ask people's questions, and I think you're going to get people who ask or come up with extreme conclusions that are way off base when they're not getting real transparent answers from people. So when you tell people who see with their own eyes, doctors who are reporting to you that they are seeing an increased incidence of acute myocarditis or acute cardiomyopathies in young healthy men who are getting a vaccine for COVID, and you ignore them and you tell them that they're not seeing things, that is not happening. You publish statements and policy statements and said, no, this is okay, we're going to keep doing this. Then you signal to people that you don't care about what they're experiencing. You delegitimize their observations, what they're seeing with their own eyes. And so then you create the scenario where you have people who don't believe you and then suddenly stop taking all vaccines. So that is, we need to see some ownership and responsibility from the people who have promoted, bad ideas on the side with their hair on fire right now. But we also and then acknowledge the mistakes and say, hey, okay, maybe we should do this differently. Let's look at whole health effects of vaccine A, or let's look at whole health effects of taking 3 vaccines on one day. And kids, and if there's parents who want to volunteer their kids to do that, go ahead and let them do that. Let's talk reality about measles vaccine. Yeah, we don't want to see kids dying of measles-related encephalitis or becoming vegetables because they got measles-related encephalitis because their parents were too afraid to give them a vaccine. And, because they think that autism is related to that. Let's show the data. Let's show the real data to them. Let's create new data. Let's do new studies if that makes people feel better. But I really do think that the status quo has gotten us into the position that we're in, where people are really distrustful of everything that you say. It's going to take us decades to come out of this. I don't. This isn't going to be an overnight fix at all. But we do have to we have to put a little bit of the brakes on the things that are saying like, oh no, no. I don't know. I think there was some statement that Bobby Kennedy made recently, saying something about not being supportive of the MMR vaccine, whereas he was once supportive of it and then and previously not supportive of. I don't know where it is. I don't know where he sits at this point. But if we have some reasonable people sitting there asking these questions who are in charge, then yeah, let's do it. Let's go for it. But these studies, these grants and things like that are funded, we know there's a lot of there's a lot of politics in those too. Who gets a grant? Who doesn't get a grant? Who all of the people involved with the Alzheimer's amyloid deposit research from Stanford on were connected to each other. These people they're not working in a silo. So this is a problem in academics. So I think a big hefty hammer is necessary. A big blunt hammer is necessary, and then rebuild. I don't know that there's a better solution for this.
Yeah.
I don't, Cam.
Yeah, I remember during the pandemic, I would write all these articles about why, for example, vaccine mandates don't work. And there's really good research on this, and you can see it over and over in these studies, right? When you force a shot on someone and they're not bought in yet, there's blowback. They go, I'm not doing this, and that research gets ignored time and time and time again. And then when it comes to trying to convince these people or win them back over, that's the one time when we don't utilize any empathy, right? As you were saying earlier, right? We have like endless, and you didn't say this, I'm giving this example, endless empathy for the drug addict, right? Endless empathy for the person who neglects their children, endless empathy for the person who's morbidly obese because you're a victim of the food industry. You're right. You can't say no to a Cheetos commercial, right? But like when it comes to someone who's like, you're forcing me to give this vaccine to my kid. And then 3 months ago, you told me you actually didn't think it was a good vaccine because you didn't like the guy who was in the White House when the vaccine came out. Oh, I'm a little uncertain about this, but
I forgot about that. Yep.
Right. We never get like, oh, well, these are people with vaccine hesitancy, right? We never get that story, right? It's always these vaccine deniers, these anti-science crazy people. Shame on you. We're just going to force you. And if you don't want it, well, you're fired and your kids can't go to school. It's like, it just boggles my mind that we like all of our empathy and all of our care for people, it just goes right out the window. And I don't know. I'm like, okay, we got to start over then. Let's start from the foundation again. Cause you guys just don't get it, I guess.
Yeah. I mean, right. Like suddenly it's Hitler in charge and, and Stalin's taken over. Like, well, you didn't see that just, 6 months ago, there's a court ruling that said that the Biden administration's NIH can't censor people online, right? You missed that. Did you? Because that actually did happen. I don't know if people know that. I think it was the National Institutes of, is it National Institutes of Cancer or National Cancer Institutes? I can't remember what it was, but there were activists who were on their Facebook pages and their Instagram pages arguing about animal studies. That's not something that I do. I'm not one of those people who does that, but I know that these people were actually trying to make posts that about how their research was being conducted on animals, and they were scrutinizing them and criticizing them. Well, the government sites on Instagram and Facebook actually hid the replies and comments from those people, or actually blocked them. And so they got sued by the organization, and then a lower court sort of upheld their ability to do it, and it ended up having to go to a court of appeals in order for the people to actually win, to be able to criticize their government health institute. Like, so that's censorship was live and happening underneath the last president, and nobody was walking around with it, running around with their hair on fire.
Yeah.
But now these same people want to say that that's happening at the National Cancer Institutes because we're flagging a few words about things that we think are concerning in your grant proposals. Like, what?
Yeah. Wish I could do the bless emoji with my hands. It's like you're just so spot on. I mean, and if you read the discovery material in the Murphy v. Missouri lawsuit, I mean,
Yeah.
it's just mind-boggling. You have Facebook corresponding with people from the White House, and the White House is saying, take this post down, ban this account because they're promoting vaccine hesitancy.
Yeah.
And then, the company says, well, what they're saying isn't wrong. It's a report in the New York Times. It's not like Alex Jones' blog. It's the New York Times. And it doesn't matter, right? So they're throttling scientifically accurate content, and they're saying it specifically. We're doing this because we don't trust the public to properly interpret this. Yes. They're too dumb to digest this science without their overlords.
Yeah.
Like, if you're an academic and you don't see the problem with that, I really can't help you. And if you don't see the problem, then I'm just going to go around you. I don't want to deal with you. I don't want to just, here, let me explain to you why this is a bad idea. I'm just done with this because you're not interested. And it's just wild.
Yeah, and that actually correlates with some of the policy too on things. So vaccine policy, in particular, the instead of having a sort of more focused policy to protect people, you started seeing a lot more broader approaches with vaccines. So when I was a resident, the hepatitis B vaccine came out for infants. And the recommendation came down from the CDC that newborn infants should get the hepatitis B vaccine. And the rationale was that they didn't want to miss the opportunity for mothers who may have had hepatitis B, contracted hepatitis B, and then passed it on to their children, even though they could screen the moms for it, and then later when these children would become sexually active, then they could be protected then. So it was, let's do them all now while we have them basically as a captive audience, and then we'll inject them all. And I remember that because in my residency program, I was actually resident during the time we actually had a morning discussion about this, and we had a debate, and I was one of the people like saying, hey, wait a minute, is this, should we be doing this? That happened with that. It also, we saw recent reports from Dr. Birx and I believe Dr. Fauci that the recommendation for the COVID vaccine was the same too. That initially they were going to target the people who were most susceptible to getting severe infection and hospitalization and death. But then they just decided to make it a blank recommendation that everyone gets it. Just because we don't want to miss anybody and we don't want to, risk getting people sick. So this, when the vaccine came out for kids and they were mandating it for kids to go back to school or to participate in certain activities in schools, I pushed back heavily against that because that was the reason they were doing it was to protect the adults or protect the elderly people. It wasn't because it was going to offer any type of benefit to the kids themselves. And so that is this broad approach to public policy translates into some of the censorship that we're seeing too. Let's just shut down all the speech that isn't in line with what we think, because we don't want these people to be thinking on their own or make their own choices about things. And so you've got a group of academics who are doing this at not the academic and institutional level, the medical education level, but you also have these same people creating public policy. That should have been the hair on fire moment for most people, but it's not, because these are the people who think that they are right. Their information is, it's okay if we give misinformation, because our interest is in the interest of doing good for people, for the greater good. So it's okay if we're wrong about it. And we're not going to apologize, because, that was what we knew how to do at the time. We didn't really know any better, or, we thought it was a good idea. But if you asking questions and you have a different idea or a different way we should be doing this, that's misinformation, and that's bad news, and that's going to hurt people. So you need to be silenced.
Yeah, it's such a joke. But like, you can use the armchair quarterback excuse if you're not forcing everyone else to shut up, right? But the people who were trying to correct you, who turned out to be right in many cases, they had their platforms taken away, right? So you can't say, like, we were doing our best, when your advice was changing week over week, and everyone who was trying to give you input was silenced, right? You just can't have it both
and not
ways.
Just silenced, criminalized.
Yeah.
In cases, people were criminalized, and I remember when the Department of Justice actually made a declaration that doctors and scientists who were basically not saying what we were saying about COVID, or what we deemed misinformation, were domestic terrorists. I remember that because I actually changed my Twitter handle at the time to, Dr. Johnson, not a provider, MD, domestic terrorist. And it was very brief, because I was a part of it. I was just so, like, really irritated by that whole thing. Like, how do you do that to people?
Yeah.
This is the United States, the land of the free, right?
Yeah.
And but now, it's not free, because there's the orange guy's in charge, and he's doing it differently.
Yeah.
And I'm not saying that they're doing everything perfectly, because I think that I think we need an approach in the middle.
Yeah.
We need reasonable people kind of making these policy decisions, and basing it on actual evidence, actual, kind of even a consensus of evidence, not your version of what the evidence is. So. Right.
Yeah. Yeah, it's so fascinating that they kick the hornet's nest and they're like, "Wow, these bees are stinging me. I don't get it." All right. Well, as we wrap up here, maybe we can try to give people a little bit of silver lining. As you said, the whole reaction of the Trump administration is clearly an overcorrection, right? They're going too far in a lot of the things they're doing. But maybe the good news is they are going to start to cut some of the fat. I don't know if they really will. Maybe we actually will start redirecting research money to projects that need to be funded. We'll stop wasting it on these bunk theories that were actually based on fraudulent images and all this kind of stuff. Maybe that will have a benefit. Or maybe, actually saw recently, I think it was a Pew poll that said that for the first time since the pandemic, the public's trust in science has actually stopped nosediving. So
Wow.
so maybe.
I mean, can it go any lower? I don't know.
Well, but that's the thing, right? I think as the pandemic kind of recedes into memory, people are starting to level out and go, okay, maybe let's take another look at this. And I'm hopeful that maybe that will start to increase. We'll start to see not just like a plateau, but people like, okay, I trust doctors again, right? If you can just lay off of your busybody condescension for just a little while, you may be able to rebuild some of your trust with the public, and maybe people will start giving their kids necessary vaccines again, and maybe they'll stop freaking out every time Bobby Kennedy says something about food dye or whatever, and they'll go, whatever. I'm hopeful that that's the long-term trend, but I think you're right. Overall, it's going to be an intergenerational solution, right? It's going to be me teaching my kids, this is a balancing act. There's a ditch on both sides. So here's what you need to know. I think that ultimately that's going to be the answer. What do you think as we
Well,
continue?
you know what? Here's what I think. I think that this podcast, I think the Genetic Literacy Project, work I'm doing through FAIR and other places, we're trying to present a balanced viewpoint on all of this stuff. We're trying to promote good science and good information that people can actually use to make their own choices about their own health. I want people to feel empowered, that you can actually affect policies that actually are beneficial to you, but you can also do things that, I mean, I think really good quality healthcare, can be free, things that you can do for yourself and to take care of yourself. And so that's part of my philosophy and my mission. And I think there's a lot of other good people out here who are trying to do that. And there's some brilliant voices, even kind of, within earshot of not only Trump and but also Bobby Kennedy and doing good scientific work, who I think can have some influence that we don't go too far in the wrong direction either way, whenever anyone's in charge. But I think a lot of it, the responsibility is going to be us as individuals and feeling empowered ourselves and empowering one another with good information. And that's where it's going to stay. I also think that the United States is, again, I said this yesterday in the space, we're a rich country. We're not, we have a lot of private funding, funding for some of these things that people think are important, who are, lighting their hair on fire. Our government doesn't need to fund every single project, right? Our government should prioritize the things that are going to be best for us, overall in the public. But if you want to go and study, cross-dressing, donkeys, go ahead. You know what I mean? Like go ahead and do it. It's not going to be the end of the world. I don't think so. I don't, and maybe I don't have that fearful mindset because what I saw from at least the last 4 years, or what I've been seeing in academia for pretty much my entire medical career, that I've seen the people in charge who are not necessarily doing the right thing for healthcare, going back to how we're teaching medical students. I believe that the pendulum is going to eventually swing in the right direction. I think that people are going to see that this stuff isn't working and it's going to actually harm people. Unfortunately, I do think people are going to have to get harmed before the people in charge actually do make a big pivot. However, yes, I do. I think we're a rich enough country, we're a big enough country that we can right this ship and be a leader for some of the other nations in the world. So I don't know. I don't have a concrete.
Yeah, that's good enough. That's
like
good enough.
Good positive answer, but
that was uplifting, and it was real talk, right? It's going to be a hard road ahead, but there's light on the other side. Whatever metaphor you want to use, I really like that. All right, well, people need to follow you. You're on X. I think it's at Not a Provider MD, right?
Yep.
Okay.
That's me.
At Not a Provider MD, and then your website is Dr. Nikki. I just had it in front of me.
Yep. drnikki.online. So that's
online.
Pretty easy to find me.
Yeah.
And connects to all my work that I'm doing. I'm doing a bunch of different things. I'm going to be starting a teaching job soon, and so I'm all over the place. So, but the best place to find me is on X and through my website if anybody wants to connect.
Very good. Go check those out, and thank you always for joining us. Thank you for joining us, Nikki, for stepping in, because Liza's all doing her thing, traveling around the country. We'll have to have you back. This was excellent, and we will see everybody next time.
All right. Bye-bye. Thanks.